Hey guys, Dr. Rodman here. Today we're going to talk about how to prevent bunions. So first of all, what is a bunion? If you look at the foot here and you look at that big toe, when this big toe starts to kind of come in this way, where this digit goes medially and this goes out laterally, that's what's known as a bunion. And excessive bone formation happens at that joint and it can become really painful and tender. And a lot of times people don't recognize these bunions until it's too late. So how can we prevent them and why do they even happen? So a lot of people have genetics, poor structure of their foot, where their foot actually is maybe very flat or their arch is flat or this digit is rotated, just genetics. But a lot of people have it from tightness in the foot over time that they don't recognize. So one thing that you can do at home to just test yourself and see if you may be having this formation occurring is just kind of feel through the foot. The area happens right here at this joint. And you want to just go ahead and look for any redness here. Is there any heat coming out of there? Is it tender to touch that joint? Are you seeing that toe start to deviate medially like that, where this part comes out laterally here? So those are all signs of inflammation and signs of that bunion starting to form. When it really gets fully grown, it's too late, and what orthopedics have to do is go in and shave that bone down. It's not a fun procedure, so let's try to avoid it if we can. One thing that also happens when we start to get people with flatter feet, you can do is test yourself with this. When you're sitting, you can look at the foot and you can see the arch here. And when you stand, does that arch flatten and collapse, or does it stay up? So if you have an arch that when you're sitting is there, but when you stand flattens, that's another predictor for bunion formation. That is what we call flat feet or hyperpronation, when your foot actually rolls in. And the problem with that is that if you look and you pretend this thumb here is my big toe, if I push off this part of the big toe where the pad is, that's where we're supposed to push off. But when we start to get pronation, that foot rolls in, we start to push off of the side of the toe where that bone is, and this part is actually pushing off the ground. So that's how bunions occur. When we push off of that inside of the toe on that bone and not on the pad over and over again, and we run like that and land with a lot of 3.5 times our body weight when we run, that's going to add a lot of pressure and a lot of excessive bone growth. So what can you do if you find this happening? Number one, what I want you to do is go ahead and just make sure this big toe has enough range of motion in this direction. So what you can do is, if it doesn't have good range of motion going up like that, it's going to want to go in. So what you can do is just kind of get into that joint, take it as far as it'll comfortably go, and just put a little downward pressure with your thumb, holding that for 10 seconds, and repeat that 10 times. You're gonna relax and then reset and do that again. So you're just kind of forcing that big toe range of motion to go naturally where it should. So that's number one. Number two, the abductor and adductor hallucis muscles, when they get really shortened and fibrotic, they actually pull that toe into that position. So what you can do at home is take a lacrosse ball, just like this one here, put it underneath your foot, and you're going to work on those muscles. So those muscles are right underneath this area and then right along that arch. So what you can do is put that ball on the floor, go ahead and put a little bit of downward pressure on your knee, and just find those sore spots and hold pressure on there. Move your foot just a little bit so you don't lose that spot, but holding that pressure there for 2 to 3 minutes. And you're going to move on to the next spot, and you can put a downward pressure on there. That's a really good way to release the tension in those muscles. What we do in the office here is we actually use our hands and we find those muscls and we do active release technique where we pin down that muscle and we stretch it. And it's more effective than the ball, but if you can't make it in here or you just want to work on it at home, these lacrosse balls are really helpful for that, and we give these out free here at Sports Chiropractic. One other thing you can do with this ball is actually work that joint capsule. So that's where this joint is. And what you're going to do is just take that ball, you're going to kind of pin down the skin and just kind of rotate that ball around that joint capsule. This might be a little tender if you're already inflamed and you're sore in there, so be careful not to do too much, but expect you could be sore for a day. That's normal. So I'm just basically putting pressure on there, tacking down the skin, torquing the ball so it grabs that skin, and trying to get the skin to move over the bone to try to free up some of the connective tissue underneath it and really loosen up that joint. And it kind of feels really good actually to kind of keep doing that. But so that's the other thing that I'd like to show you. The last thing is Orthotics. This is something we make here and they're custom. And if you kind of see, when you have that foot that hyperpronates or rolls in and starts to push off this big toe, that's how we get those bunions. So Orthotics basically align your foot in a good position and don't allow you to roll in. They kind of build that arch here and put a block on that range of motion so it can't hyperpronate and start pushing off this. So custom Orthotics are great. If you can't afford a pair, because they're not cheap, but they're very nice, you could buy something generic that is at least better than nothing. But a custom pair is always the way to go because it's built for your foot. We do build these here at Sports Chiropractic. If you're not in our area, we can refer you to somebody close to you if you want to send us an email. So I hope you can use that and help yourself. Don't let that bunion formation form. You don't want to get a surgery if you don't have to. And Dr. Rodman, have a great day.